All right, everyone, please be seated. All right, you're still under oath. State.
Okay. I am Dr. Gebhardt. I'm going to show you some of the exhibits that have been admitted. I'm going to put them on the view. You mentioned before that you saw injury to her ear. Both ears. Is there any significance in that to you?
Yes. So when you do, when you're taught how to look for child abuse, one of the things that is kind of a red flag, not necessarily it never happens, but injuries to the ear are kind of atypical. And so injuries like this injury where where you have kind of old scarring and wounds there, those are kind of consistent with being grabbed.
And she had that on both ears?
She had on the other side, I believe she had a fresher wound than that. Yeah. So this, she has the same kind of thing here.
Okay. And then I'm going to show you State's Exhibit 12. Maybe a little hard. Can you see it okay?
Yes.
So, is there anything unusual about the bruising on her arm?
It's hard to tell. It's easier to see in the actual picture.
Okay.
But you can see that there's marks that are consistent with fingerprints in there. I can show you up close.
You can step down if you wish. And Mr. Fawley, you can move yourself around with the witness.
Thank you, Judge.
So you can see a significant amount of bruising back here, and then you can see where there's a finger, or what looks to be like the indentation for a finger here, here.
Thank you.
And to parties, just feel free to move about the courtroom if the witness leaves the stand. You don't have to ask permission.
Thank you, Your Honor.
I'm gonna show the first page of State's Exhibit number 18. If you'll let me. Okay.
I don't think State's Exhibit 18 was admitted, Judge.
Yes, State's Exhibit 18 was admitted, but the lettered numbers of 18 was not.
Oh, I'm sorry. Yes, I apologize. That's I got it.
What are we looking at?
So these are this is a growth chart, or not a chart necessarily, but just a sheet of dates on the side and her anthropomorphic measurements. So basically how tall she is and what her weights have been doing over the course of time. And so she's 4 years old, 4 years, 3 months at this point. or almost there. And what was kind of striking on this was children usually just get bigger. And so when they have a fall off, when they either stop gaining weight, it's concerning. And especially if they start losing weight. And so she had multiple visits in April of 2016, where she was consistently had gained, and was in the 13 kilogram range or above it. And then by the time she was admitted a year and 5 months later, had lost weight.
And her height, so it says 86.36 centimeters in April 2016 and 92 centimeters on September 5th, 2017. Would an increase in height, should that have itself caused her to gain weight?
It usually does. The body typically will, or for children when they're growing, your brain, you're going to feed your brain first. So your head size will hopefully continue to grow. Your height usually will be the next thing to go, but it will try and preserve that. And then the last thing is weight.
Thank you. When was Olivia officially declared dead?
So I don't believe I have
Bring
that.
those records back up there.
Sure. I have it right here. So we were waiting on an ancillary superperfusion scan. So when the perfusion scan was read is the official time of death. So pronounced dead on September 6th, 2017. Is this from trauma? Yes, at 13:55.
Okay. So can you explain for the jury what a brain death is and what the steps are?
Yes, ma'am. So a brain death test is a clinical diagnosis. So what you're doing is you're making sure that every aspect of the brain from top to bottom has no function. So with a brain death test, you're really looking at, you go in, you push really hard here and here. There's a nerve that comes out called your supraorbital nerve, and you can kind of feel it on your own body. But if you push on that nerve, you should get pretty intense pain. And we see that there's no reaction to that. I pinch all of the nail beds pretty hard to see if there's any reaction from it. Then you say their name loudly, you do a sternal rub, try and wake them up. The next thing you do is you then start doing the brainstem reflexes. And so because she was in a C collar, there's a couple of ways to test a few of the nerves, but cranial nerves 2 and 3 are the pupillary light reflex. And so you shine a bright light in their eyes. You see if there's any sort of reaction with the pupils. Next, I do a cold caloric test where you shoot cold water into the inner ear, and it should cause you to have some nystagmus. And that is cranial nerve 8 that's being tested along with your ocular muscles. So cranial nerves 3, 4, and 6. And then you have, I do a corneal on you, which you should have your 5th cranial nerve intact, which lets you feel all of your body or all of your face. And so you gently rub cotton across the cornea, and that should elicit a pretty quick blink response from both eyes, so that you protect your eyes. That when that's missing, the next you go down to check nerves 9 and 10. 9 and 10 are, you put a Q-tip all the way to the back of the mouth and poke multiple times to see if you can elicit a gag reflex. And then with the breathing tube in place, it's easy to check a cough reflex. If you, right where your lungs branch, so when your trachea comes down and where it branches, that area called the carina, C-A-R-I-N-A, is really sensitive to causing a cough reflex. And so we'll stick the suction catheter down past the tip of the ET tube and onto the carina, and that should elicit a pretty profound cough reflex. And this is all done in conjunction with, you haven't had anything that could potentially blunt that or cause you to have poor brainstem reflexes. So this means that your blood gas is within normal ranges. It means that your electrolytes have been brought into an acceptable range. And so this young lady was had diabetes insipidus because her pituitary had died. And so she was on vasopressin to get her to quit just dumping out water. And so all of her electrolytes had been brought back into a normal range. She hadn't had medications in the 24 hours prior that would have blunted the reflex. And she wasn't on any sort of paralytic medication. The last part of the test is doing an apnea test. And so an apnea test involves taking the person, you pre-oxygenate them with 100% oxygen. And so the lungs are a big reservoir of oxygen. And so you can actually go 5 minutes without breathing as long as you have all that oxygen in there. And so we'll put them on either a T-piece or put them on an anesthesia bag that just allows there to be some pressure in the chest that allows you to keep the lungs open. And then we will take the ventilator off, do a blood gas, and then when your brain is dead, your brain eats about 80% of the sugar in your body that if you're just resting. And so it takes a while for the carbon dioxide to build up. But if you go up by over 20 points in that period and you don't attempt to breathe at all, then at that point you're considered brain dead. If you're unable to perform that test, then we have ancillary tests like a nuclear medicine brain scan. And what they do is they inject a radionucleotide into your bloodstream, and that will give off little bits of radiation that can be picked up on a monitor. And the blood doesn't flow to dead tissue. And so it will go up and you will just see this impressive lack of blood flow. And you'll see this head that lights up and you can see a little bit of this scalp. You can see ears in the face, but the whole brain will look like there's nothing there.
Okay. So was Olivia brain dead?
Yes. And I believe she was pronounced by Dr. Veronica Armijo.
When I had that chart up earlier with her weights, were you able to tell from your the medical history what those admissions were for?
Those the ones in April had been for little head wounds.
Okay. A couple times it's been brought up that Olivia had what's been referred to as raspy.
I couldn't hear you.
A couple times it's been brought up that Olivia had raspy breathing. Can you explain that?
So one of the last things to die inside of your brain is that brainstem portion. And so that's why you get really high blood pressures, because it's what controls your blood pressure. It's what controls your breathing. It's what basically is what keeps you alive when you're asleep. It just runs on its own. And so that raspy breathing is usually what happens as parts of your brainstem start dying. you lose your ability to really protect your airway. And that by protect, I mean cough, gag, that kind of stuff, keep the secretions out of the back, and you'll continue to breathe. And so you get this, it's called the death rattle. And so as you are progressing more or farther along, you get to the point where you just kind of hear this really deep guttural gurgling sound.
When somebody is at that point, what does that tell you as far as how long their brain had been causing them significant damage?
I don't know exactly how long the significant damage has been there,
Mhm.
but it usually means that they'll probably be dead within the next 24 hours.
Okay. Earlier, we mentioned that, or you mentioned that Olivia had a stroke.
Mhm.
Typically, when people think of stroke, they think, someone with heart issues. Can you explain how that's
Sure.
relevant to a 4-year-old?
So a stroke basically is anytime you don't have blood flow to your brain, be it from an artery that bursts inside of your head and doesn't allow perfusion to certain parts of your brain because it's just swollen. And then you can also get them when as you age, your carotid arteries can also get little plaques that build up and you can throw a clot into your brain. So those are all ways you can stop blood flow to the brain. In her, when I say stroke, I'm saying it's just anything that can kill brain tissue by not letting blood flow get there. And so because of how profound the swelling was in her head, she was unable to get blood to flow into her head to perfuse her brain, and her brain died because of that.
Okay. And when you mentioned that there had to have been at least 6 to 8 hours, what was that in relation to?
So from the CT scan, you're not going to see acutely that loss of gray-white differentiation because it takes time for the swelling to develop. And so it usually takes 6 to 8 hours for that to get to that point where you would see that. It could be longer than 6 to 8 hours, but it's at least that amount of time,
Okay.
usually.
So if the scan was at roughly 1:30, then it would have had to, in your opinion, it would have had to have happened sometime early morning
Early morning, yes,
or
or the evening before.
the night before. Okay. Thank you. I'll pass the witness channel.
Defense.
So this hemorrhage in the eye, that was a Rentrac hemorrhage? Is that what you called that?
A retinal hemorrhage?
I'm sorry?
A retinal hemorrhage?
A retinal hemorrhage.
Yes.
Okay. And then let me ask you, you said that comes from shear forces?
It can come from shear forces, yes.
Explain to us what a shear force is.
So anything with kind of a rotational movement to it, any sort of rotational movement where you're having acceleration, deceleration injuries in a kind of a torque-like fashion.
Okay.
And so you'll have different speeds of things moving, basically.
Okay, so like, do you do any sports medicine?
Sometimes, yeah.
And do you often see shear force injuries in sports medicine?
Usually it requires a lot more force than what you typically would see in like football injuries. And so usually there are not retinal hemorrhages in sports related injuries.
More force than like basketball players get?
Yes.
More force than football players get?
Mhm.
More force than boxers get?
I don't deal with, I've never met a boxer
Okay.
in my practice, at least.
And you haven't treated, okay.
Yeah.
But a lot of force.
It requires quite a bit of force.
Okay. And
And an unconscious and usually an unconscious patient, because if your neck is strong enough, you're not going to have the same kind of whiplash type injuries that would cause the shear.
And then what causes, I know there are several causes, but what are some of the causes of a pneumothorax?
So some of the causes of pneumothoraces, you can have either, you can have blunt trauma to the area. So if you're in a motor vehicle accident and you kind of close your airway off, like, and then, get hit by something pretty hard, that can cause the pressure inside the little air sacs they're really delicate, and they can expand and cause pneumatoceles that can rupture and let air out into the cavity. You can have blunt injuries or penetrating injuries that will rip through. So bullet wounds are typical for it. You can have iatrogenic causes. So if you get aggressively bagged with, an anesthesia bag or whatever, you can potentially pop the lungs. There are lots of different potential that could happen.
Okay. And there's spontaneous pneumothorax, right?
And there are spontaneous ones. So if you're a tall male in your teenage years, you can just be running along and then pop your lung.
And then, so when you were talking to Jessica, you testified that she said that Olivia had fallen off a chair, I think, on Friday night and hit her head, right? This is Tuesday you're talking to her.
Yes.
Okay. And she had fallen off a chair on Friday night and hit her head. And then she also mentioned that she had come in, that Jessica had come into the room the night before, so Monday night, and seen her sitting on the floor, had heard a noise and seen her sitting on the floor, correct?
Yes.
And that she didn't know if she had fallen or not.
Mhm.
But she didn't change that story, right?
I don't remember if she changed that story. So I encountered her. I took my history, but I think I was one of the very first people to meet with her.
Sorry, when she was talking to you,
When she was talking with me, yes, she
it
did.
wasn't, oh, she fell on Friday night. Oh, wait, she fell on Monday night. It was, these two different incidents happened.
Yes, sir.
Right, okay, because there are a lot in State's Exhibit 18. There's a bunch of people who rely on all of this record, correct?
Yes, sir.
And those people go through, and sometimes they'll rewrite the history without taking a fresh history. They'll just look at what you wrote down as the history,
Mhm.
and then it's like a game of telephone, and they write down their own history, right?
Yes.
And a lot of the people who were doing that in here say, well, she changed her story. First she fell Friday night, then she fell Monday night. That's not what Jessica told you, correct?
Yeah. So what I wrote was 11 a.m. went to the gas station, blah, blah, blah. So yeah, on Friday, she fell backwards off a chair and hit the posterior aspect of her head, but was consolable, did not complain. The night prior to presentation, put Olivia in a room to go to
That's
sleep.
Monday.
Yeah,
night
that was
prior to
Monday.
presentation.
And she was in her usual state of health. Then she at some point was sitting on the floor crying, but went back to sleep. And then 10:30 the next morning, she vomited but didn't check on her. And then checks on her at 11 and she didn't wake up. And at that point she shook Olivia to wake her up. Got her to
Okay, but there are other people in these records that are saying that she couldn't make up her mind about when Jessica, about when Olivia, that Jessica could not make up her mind about when Olivia had gotten hurt. That they say that first she said it was on Friday, but then she changed it to Monday. She, at least when she was talking to you, she never changed her story, right?
when she was talking to me, there was no changing the story.
Okay, and that could have been a misunderstanding by somebody that was taking notes, correct?
It could be. A lot of the times in cases like this, so our social workers and especially like the Center for Miracles will get involved And so the Center for Miracles is a group of child abuse pediatricians who come and evaluate these situations. Whenever we have a kid with a head bleed or something like that, we will call them in just to, they come in and they will do their own history, do their own physical, and come up with their own conclusions as well. And then the people that tend to copy and paste are like the neurosurgeons. When they come in, they're usually pretty busy. And so we will give a quick history to them and they'll say, okay, and they'll look at the scans and go from there.
Okay, but so it could have been somebody taking a fresh history that wrote that down,
Mhm.
or it could be somebody that was copying and pasting one of the many histories that are in there,
Exactly.
and we just don't know. Right, but we do know that doctors don't make mistakes, correct?
0% of the time.
0%, exactly.
Yeah.
So it could be that one of those doctors taking a fresh history could have just written it down wrong,
Mhm.
right?
Yeah, absolutely. I can't vouch for anybody else other than myself. I
Okay.
just know that when I go in situations like this, I usually take a computer with me so that I can put in quotes different things that people might say. And I just make sure that my history is exactly what is consistent. So I'm typing as I'm talking.
Sure. So you don't make mistakes.
I try not to,
You try not to,
but I do.
We all do.
Yeah. That's
And
what
the
this
reason,
means is I make mistakes.
the reason I'm asking you about that, cameras are gone.
Yeah. Sorry.
The reason I'm asking you about that is you had in your notes that Jessica heard vomiting and did not go check on Olivia.
Mhm.
That she didn't check on her until she came back from the
gas
the
station.
store.
Mhm.
Okay. Is it possible that you wrote that down incorrect?
It is possible. It was 5 years ago, but again, when I do these, so at Texas Children's, one of my mentors was really big on documenting these, and we had to document like 3 of these cases to her satisfaction. And so you learn pretty quickly that you go down and you get every possible thing that you can think of. And that's why I have her phone numbers. I have different dates and her date of birth and all these other things in here so that every I is dotted, every T is crossed,
Sure.
so that I'm consistent.
Nonetheless, you could have made a mistake. Well, let me ask you this. If Jessica talked to 5 or 6 other people that day and told them all that she went to check both before you and after you, and is on video telling them all that she went to check on her as soon as she heard them throwing up, would you then maybe reevaluate whether you may have made a mistake or maybe whether she misspoke?
She could have misspoke. I wouldn't put it in my note unless I specifically asked.
Right.
And would it make me reassess it? It might make me reassess it. There were a lot of red flags in this case, that this was just another red flag in a field of them. And so when you have, injuries of different ages, injuries that are healing, and then you have scars on the hands and the feet that can't really be explained that well. You start asking very detailed questions, because a lot of the times when people aren't telling the truth, their story will change. And so I don't know if would it make me reevaluate it? Yes, but in context, it might not make me reconsider.
So let's talk about that. So have you reviewed these records, by the way?
I went through a lot of them. I didn't go through every single one.
Everyone, sure. Good. But on page 67, can you tell me, I'm just gonna do this portion just so that you're not in the last page of that is 67. I will give you any other part of it you want if you need it. That the scars on her hands and feet could not be explained particularly well, correct?
Mhm. I think when I documented it, she had told me that they were from feral cats that she fed.
That Jessica and Olivia feed in the neighborhood.
in the neighborhood. Yeah.
Okay, and in fact, someone else, who's thinking of Devin, if you need more of this, if it's signed,
It's okay.
it might be signed after that.
Yeah. See, this is somebody who uses a very long note template. Okay. So it's McDermott. Inpatient consult. Yeah, I think it's signed after this.
After, okay, so there you go.
68, 69. It's every lab value that was ever drawn. So this is James Lucifer and Dr. North.
And who is James Lucifer?
He's one of the child abuse pediatricians from the Center for Miracles.
Okay, and they're on page 67. He knows that, or his intern that he was supervising, whoever it was either him or whoever he was supervising, but he signs off on the note that says that those scratches on the hands and feet were consistent with, we'll read us exactly what it says.
Let's see.
It's up toward the top here.
Skin comments. 3 centimeter linear scar on right chest, numerous small abrasions, scratches, and scars on the lower extremities consistent with age appropriate. Sorry.
And speak up just a bit so that
Sure.
they can hear you.
Scars and on the lower extremities consistent with age appropriate play.
Okay, so he at least thinks that. Go ahead.
No, go ahead. I'm listening.
Oh, okay. And I was just gonna put this back together so it doesn't,
Yes.
so that she doesn't get mad at me. Thank you.
And I think there's a picture of her hand. That
Uh-huh.
You can see the scarring on the hand as well.
Right, but this doctor, this child abuse specialist
Mhm.
believes that those
They could be consistent.
scratches are
Mhm.
consistent with child appropriate or age appropriate play, right?
Sure.
Okay, and then, we talked about,
I think that's 13.
I think
Or
that's
it's 12.
12.
Oh, no,
Yeah,
it is 12.
sorry.
You're right.
we talked about states 12. We think it's 12.
Yes, sir.
And about the finger marks
Yes.
on there. And you pointed that out to the state right before launch, correct?
Right before lunch. Yes.
Okay. And I was in the room and you said something to me like, sorry, this is kind of devastating, right?
Yeah.
And then you and I talked in the elevator and I said, well, but she was carried for 5 blocks, right?
Mhm.
And you agreed that that could have caused this
If you're carrying somebody by their arms like this
for even part of the time.
for even part of the time, it could be consistent with that. Yes.
And then I said to you, so it's devastating if you're looking for child abuse,
Yes.
right? And you agreed with that.
Mhm.
You said that's a good point, right?
Absolutely.
Okay, so, and that is that's something that I just want to point out here is that a lot of times, I mean, I understand this is what you do for a living and you also see cases of child abuse all the time, right?
Unfortunately.
Far more than you want to.
Yeah.
But you kind of tend to start looking for that, right? For the what you call the red flags.
Yes. So whenever I see a kid that has a brain injury of any sort, I feel like it's my job is to make sure that it isn't child abuse, because I would rather make 150, 200 moms upset that I'm going down that path than let one kid go home with
Sure.
somebody who's abusing them.
And nobody,
Faults that.
is questioning.
Yeah.
You're doing that. Let me also ask you this, though. The first page of States 18, which was that growth chart
Mhm.
that we talked about, that All right, so, where did these dates? Where did those come from?
Those came from the electronic medical record. And so whenever she had a visit with her pediatrician or an outpatient clinic, if they documented a weight, it would show up in the chart.
Okay, so the last time, in fact, that Jessica brought Olivia into university health system anyway, and she could have gone to other
Absolutely.
providers, right? But the last time she came into university health system before this incident was on 4/15, was on March, April 15th of 2016.
Mhm.
Right?
Yes.
And that is further documented in State's Exhibit 18, right?
Yes, I think the visit is documented.
Yeah, okay. So it explains why she was there and
Mhm.
gives, you know, the same sort of, they'll take a history and somebody will write down that and
Yes.
the narrative of what happened, correct?
Yes, sir.
And these narratives that she gave back at the time that these injuries happened, that she brought her into University Health System, have you looked at those visits?
I looked at them probably about 4 months ago.
Yeah, okay. But those injuries that she explained then were the same explanations that she later gave, that she gave to you, that she gave to the detectives who were on site, that she gave to everybody as to how those injuries have been caused back then.
Yes, sir.
Okay, so it's not like she all of a sudden tried to come up with a story of, oh, yeah, that scratch on her head or that scar on her head came from, you know,
Yes.
it was consistent. She has never varied from that statement of what happened.
Yes, sir.
Okay. Usually you said about those the calcification on the arms,
Mhm.
that those could come from a break,
They can be. Yes.
but they can come from other trauma, correct? To the
Yes.
arm.
Yes.
Trauma would include things like if you shut a kid's arm on her door, right?
Yes.
Whether you did it accidentally or on purpose.
Yes. You can't tell one type of injury necessarily from another, especially when they're old.
Right, okay. And so if Jessica told the detectives that she believed, and so we actually don't even know that Olivia's arm was ever broken, correct?
I believe on autopsy, her left arm had a break with the callus formation. Her right arm did not have a break.
Okay, and we can check that because I'm sure the autopsy will be coming in. But at least when you were treating her, you couldn't tell if it had been broken or if it had been some other type of trauma, correct?
That's correct.
And so, because that calcification happens and even ossification happens just from, it could happen from an injury that just shows a bruise at the time, correct?
Potentially, it would be a pretty bad bruise. Yeah.
Yeah,
But-
okay, all right. So if Jessica were asked, how did that happen? And she said, the only thing I know of is I closed her arm in the door a couple of times, or more than a couple of times, a few times. Is that consistent with that type of ossification, or sorry, I guess it was calcification?
Yeah. So if she had closed both arms in the door at some point,
Right, they wouldn't have to be at the same time, right?
no,
Because you can't tell the age of those.
you just know that they're older injuries
Okay.
because it takes time for those to develop.
For the calcification. So she said she had shut her arm in the door the Friday before, or maybe it was the Thursday before. That's not going to cause that kind of
No.
calcification that quickly, right? But she also said that she had closed her arm in the door previous times.
Okay.
And says it was accidental. Again, the record, the physical record doesn't exclude that, right?
Mhm.
It's perfectly possible that that's what happened.
I agree.
Okay. And that lack of gray-white differential that we talked about, gray matter, white matter differential, explain that again. And I'll put that picture up against it.
There you
So states 22, and then just this, I'm just gonna put this one up first. This is the picture of a healthy brain that you were using just to help explain to the jury what a brain is supposed to look like, right?
Yes, sir.
Can you show us on there? And you can even step down here and use like a pointer if you
Sure.
want, if it makes it easier. But can you show us what you mean by gray matter, white matter differentiation?
Absolutely. So when you're looking,
Turn that way so the jury can hear you.
when you're looking at the brain here, you can see the different areas out on the periphery
Okay.
here, where it looks, this would be the gray matter, so it's kind of flipped over.
Which is the gray matter?
The outside that looks a little bit lighter. And then
Just the very outside.
the very outside here, and then you can see how there's a border right here, all
Okay.
here, like that. Those are white matter tracks that run through the brain.
So are you talking about like this, what do I have my pen on right there? Is that gray matter?
And excuse me, could the parties make sure that you don't mark on that?
And it's not an evidence.
Okay, all right, thank you.
But so, and I'll close my pen. But this area here is, I'm now on gray matter, right?
You're on gray matter, and that particular area is that little dark region in the middle is a sulcus, so an indentation in the brain.
Okay, and then
That is white matter.
that's white matter. So what's darker here is actually white matter,
Mhm.
and what's lighter here is actually gray matter.
Yes, sir.
But that's the border right there.
Mhm.
And that's where you want to see the differentiation.
Yes, sir.
And that's what we don't have here. It's all kind of scrambled. correct?
Yes. There, you have a kind of a homogeneous
Okay,
black brain.
okay, you can, let's see, thank you. And that type of injury, that type of lack of differentiation, that basically it's essentially a scrambling of the brain, right?
Yeah, it's indicative that there's just so much swelling in there that you can't even tell one part from the other.
Does it come from the swelling? Is that why you can't see? Is that why you can't differentiate?
Yeah, so all the cells basically at that point have they've died and they start accumulating. They can't regulate the different salts in the water that's going in and out of them. And so they all swell up and they all start looking the same.
And is that typically from a moving head injury?
It's usually, I mean, it can be from a lot of things, but usually when it's that profound, it's usually because there's just no blood flow to the brain.
Okay. You said earlier that the subdural hematoma, the one that's under the dura, under the covering over the brain, right? That's this here, right? Just
It's this area. It's this area. This is the bleed. Right there.
oh, okay. Okay, and you said that those typically are there's a lot of things that can cause those too, correct?
Yes.
But an acceleration, deceleration type injury is probably the most common, correct? And by acceleration, deceleration, what do you mean?
Like hitting your head on something,
Stop it.
stopping, or either stopping, or just if the brain sloshes back and forth inside the cranial vault, it can also cause that. So
Okay.
just being flung forward and flung backwards.
But it's not typically going to be caused by something hitting the head, right? It's going to be caused by the head moving and hitting something, stopping.
It could be either or. So
Okay.
if something hits you in the head, you start moving back, and your brain is like, it's kind of the consistency of Jello. And so when you start moving it really fast, the brain can move forward and shear. And then it's a coup contra coup. So like a hit, and then the other side of the head can also get a hit on it because the brain will slosh back and forth.
Okay. You mentioned earlier, I mean, that happens in basketball, right?
Mhm.
And you said this doesn't look like the type of injury that you would see in sports.
That's correct. So you can have injuries that you can have a subdural per se. So you can have people that fall and hit their heads, or get, a tree branch that hits them. This is a very common injury for like 14-year-old boys because they don't really pay attention to a lot, and they will get hit in the head and they will bleed, but it's not the degree of it is different. So like a single injury that leads to a small subdural, I see those quite a bit that come through the PICU. So,
And they don't kill you.
and they don't kill you. This one has a lot more brain injury to it, and that might be because of the amount of time. So usually if you fall and hit your head in basketball and go unconscious, you get brought to the emergency room and they take care of you. And if they need to evacuate the hematoma so that your brain continues to get perfused, they take you to the OR, or they bring you upstairs to me and I pour a bunch of salt in you and pickle you to make sure that you have enough space in your head to continue to get blood flow. And so this looks like somebody who had a bleed and then time went by and caused more severe injury.
Okay. So and you said that's what you were talking about, that usually you're going to see these after an injury that severe after 6 or 8 hours.
Yes.
Okay. It could be less than that though, correct?
Well, usually you won't see the brain turning this black until it's been dead for a few hours. So like 6 to 8 hours.
And again, you keep saying usually, right?
Usually, I mean, I can't say for 100% of the time because I haven't seen 100% of head injury CTs and all that stuff. So
Okay.
in
What-
general,
I think you talked about diffuse, was it axonal injuries?
diffuse axonal injury, yes.
What is that?
That's something that happens again with rotational injuries. So the rotational forces in the brain, you see it a lot in car wrecks, where those white matter tracks, that's from one cell, that white matter tract will go all the way across or down to talk to another cell. So they're really long axons that run from that nerve. And so anywhere along that, it can get broken and from getting like sheared off or torn off. And so those also contribute to the amount of basically trauma and swelling that's going to happen in the brain.
So
But that you have
You
to have
said-
an MRI to diagnose.
sorry, go ahead.
You need an MRI to diagnose those. And usually in these kind of settings where you're just trying to get somebody stabilized, MRIs can take hours to do.
You don't have the
CT
time.
scans are 10 seconds.
Gotcha. So but what we can tell based on these injuries, what we do know is this didn't happen from a fall off a chair, correct?
I would say there were multiple different injuries that happened in over a period of time that would not be explained by a fall from a chair
Well, I'm talking about the injuries of,
in the brain.
yeah, the death, what killed her, what
What killed her?
happened.
Yeah, so this sorry, can you repeat your question?
Sure. So I'll just ask a different one. So,
Edward.
these injuries, and when I say these injuries, I'm talking about the ones that killed her and the ones that were immediately attendant to that. Whether we don't know that they happened at the same instant, but we know that they happened pretty close together, right? That those were not the result of a fall off a chair, correct?
Most likely they were not the result of a fall off of a chair from 4 days prior. So,
I didn't say 4 days.
or falling off, if she fell off a chair, could she have had that? Maybe. With the subdural that bad, but she would have had signs leading up to that would have been worrisome. So the vomiting, all those other things, lack of consciousness.
You're talking about if it had happened on Friday night.
Yes.
Right.
And then if it had happened, even not like, I don't know when exactly this took place. I can just tell you that it happened, the final blow, the stroking out of her brain happened multiple hours before 1323.
Sure. Okay. And again, it appears to be, we can't say for certain, I understand, but it appears to be that this was multiple injuries sustained at the same time or very close together in time.
It was probably, I mean, it only takes one good hit to kill somebody. When I'm talking about the multiple injuries, I'm talking about all of the injuries that we could see on the child. All of those injuries had happened over different time periods.
You're talking about the scars and stuff.
Yeah.
Right. But I'm talking about, like, there was the bruise across the nose.
Mhm.
There was the hematoma
In the
on
back.
the-
Those all seem like they happened pretty recently,
Yeah.
just based on the coloration of the bruising. Those look like fresh
And
bruises,
possibly the pneumothorax,
and possibly the pneumothorax.
although that could have happened as a result of treatment, right?
Yeah, it can happen. So sometimes if the breathing tube goes in too deeply, usually it's not. So that breathing tube was in too deep, but it was in the wrong side to cause a pneumo. So if you put it into the right main stem, which is what that was, and you try and put, twice as much air in their lungs and you put it all in one lung, that can pop it. However, if you don't put it in the left side, usually what that will do is the air will just kind of leak out and the lung will collapse down, but not cause a pneumothorax. It'll just kind of suck everything over to it. So from a treatment standpoint, that one's backwards for causing a pneumothorax.
You're talking about the intubation.
The
from an
intubation.
intubation standpoint, but somebody had also done CPR previously.
Yeah,
That
and
can
so
cause
CPR can cause pneumothoraces. I don't think I fully answered that, but yeah. So it was broken ribs, crush injuries, anything. Lots of things can pop your lung.
Okay. And you said that I think, and correct me if I'm wrong, but I think you said that the injuries to the ears, it's not necessarily that it never happens by accident, but injuries to the ears are consistent with child abuse, correct?
Mhm.
What does consistent with mean?
So consistent with child abuse would be any injury that is seen that seems out of the ordinary. So if you have injuries that are more commonly seen in abusive situations than in a child, like age appropriate play kind of way. So it's, you know, if you have one ear injury, that's, you know, okay, I have an older brother and I think I have a scar on the side of my face from when I got pushed into a typewriter. It's, you know, one-sided makes sense. You can kind of explain that away, but when you have kind of the bilateral injuries that happen, like it gets harder and harder to say, oh, that just, well, she fell that way and then she turned around and did it the exact same way. Those are what I mean by consistent with.
But it's
It's not exclusive of child abuse by any
Okay.
means, but it's also, it's another red flag in a field.
It's an indicator. Okay. And what we do know, though, is that it's very probably, unless somebody took some forceps and put them around her head and squeezed, right, that it probably came from separate injuries, correct? Not necessarily separate in time.
Yeah, but separate injuries.
Causes,
Mhm.
right? And that could be somebody
Grabbing the ear.
grabbing the ear. It could be that, you know, it could be from a hit on the ear, right?
Mhm.
And then a different hit on the other ear, correct?
Yes.
Okay. Here's what bothers me. Is these reports, Jessica, for one thing, well, I mean, I know you only see it in the OR, sorry, in the ER or in your practice. That you only see child abuse there, or I hope you don't run into it anywhere else in your life, but is it typical for abusers to bring their kids to the hospital after they?
Yes.
Okay.
So when I see it quite frequently, you know, the kid will stop breathing and they're like, oh God, what am I supposed to do now? And then they'll rush them to the hospital, or they'll call their significant other and say, hey, your baby's having a seizure. And then they get rushed to the hospital, and then but it's not abnormal to see somebody that goes a step too far and then brings them in.
It's not abnormal, is that what you said?
Yes.
Okay, so, and that's consistent with what happened in this case, right?
Mhm.
But it's also consistent with, that is, when somebody brings their child in that's not breathing, somebody who didn't do anything wrong would absolutely do the same thing, right?
Yes.
Okay, and then even, but I'm talking about with less severe injuries, with, you know, just like closed head injuries, that aren't, where the child's not showing any signs of, you know, I can't even think of the word, that they're not showing any,
Indicators that they have a severe injury inside their head.
thank you,
Okay.
a severe injury, right? That, you know, that somebody then brings them to the hospital, and Jessica was doing that here, correct?
She did bring her child. Yes.
And when she did that, everybody at University Health Sciences Center and everybody at the clinic, everybody in the University Health System is a professional as defined by the reporting statutes, correct?
Yes.
Which means that they're required to report if they believe that there's any child abuse going on. If they
That's
have any reason to believe
Mhm.
there's child abuse going on, not when they're sure of it, but if they have any reason to believe.
Yes.
And when Jessica brought her child previously, nobody reported this to CPS, correct?
I believe that's true. Yes.
So there was no, and y'all have an in-house unit specifically, the Center for Miracles, right? Is that part?
Yeah, they're not technically in-house. I think they run out of the Children's Hospital of San Antonio.
Oh, okay.
But they were very familiar with them. Yes.
And if on another occasion she took her daughter, if evidence comes in that on another occasion she took her daughter for an injury to Children's Hospital of San Antonio, by the same token, if they thought it was child abuse, they would have reported it, correct?
Yes.
Okay, and nobody at UHS, nobody in the UHS system did that with Jessica because there was no reason to believe, based on these injuries, that she was abusing.
Your Honor, that calls
could
for
I-
speculation.
Just 1 second. When either side stands up to make an objection, All right, thank you. All right, the state's objection will be sustained, which means you can't answer it.
I don't know what the objection is, Judge.
Speculation. Speculation.
You've reviewed these records
I've reviewed the records.
and there's no, in those reports of previous incidents of Jessica bringing her daughter in, bringing Olivia in, there is no indication that anyone from UHS ever reported this.
So in the records, so when she brought her in when she was 2 years old, and was thriving based on her weights and stuff like that. Based on that and based on the injuries that she brought her in with, like a small laceration to the head, that got a few stitches and then went home. They did not send that to CPS.
Okay, but you said when she was 2 years old, but looking at the first page.
Yeah, so
The last date that she was brought in was April
of 2016.
14th. Sorry,
She's just under 3 years old at that point.
yeah, okay. And if we look at her weight there, right?
Mhm.
On the 8th, on the 14th, and then again on the 15th, I guess. On those occasions, if we look at her weight there, weren't you saying that that's not consistent with her
That
age?
those are more consistent with her age. The one that's more worrisome is that she shows up on 9/5, and so she's almost 15. She's significant 17 months older at that point, and she is still, and she's lost 1.4 kilos. So she's lost over like about 3 pounds
Okay,
of weight, and that's what's concerning.
well, all right, but we do know that that on those other occasions, she was brought in for traumatic injuries, again, not as severe, but traumatic injuries. And okay, she may not have been underweight then, but is that the only reason that people are required to report to CPS?
It's the only reason you report to CPS is when you have a suspicion. So if something comes up that doesn't feel right, smell right, if you have an inconsistent injury, those are the times that you are required to report. So if you have, a kid that shows up with a 4-year-old that has gonorrhea is abnormal, and you have to report that. Kids that have multiple injuries that you can't really explain, you're required to report.
That's precisely my point, is
Yes.
that there was nothing suspicious about these injuries that would have aroused the suspicions of at least the UHS.
Yes, the people in the clinic that saw her for those it didn't concern them.
Okay. No, just a second, Judge.
Yeah.
Oh, there's a record, and you can review the records again if you need to, but that they did do a tox screen on Olivia, correct?
Yeah, that's one of the standard labs that they draw in the trauma bay.
And they did a tox screen for drugs, correct?
Basically, yes.
And was there anything?
I don't recall, but I don't think that there would have been. I don't recall that she had
Refresh your
one.
memory to
Please,
be able
yeah.
to look.
Your Honor, again, the state's willing to stipulate she did not have any illicit drugs in her system.
I can find it.
Ah, good.
Yeah. think. And I would have put it in mine. Yeah, it's actually in my H&P. There we go.
Oh, good.
UTOX negative. So
I'm sorry.
urinary toxicology is negative. So
Okay.
that tests for cannabinoids, benzos, opiates.
You can hang on to
Okay.
that one and hand me that one. Thank you. And when you spoke to Jessica, there was no reason to think she was, you didn't suspect she was on drugs, did you?
I didn't suspect she was on drugs.
Um, sorry, Judge, can I have just a second?
Yes.
Thank you. Oh. Yeah, sorry, I am gonna have to have you dig out that
Toxicology.
toxicology. Well, there was it was done, I guess, right at the same time, toxicology and
The
chemistry, hematology.
the CBC on it.
Sorry,
Which lab are you looking for? The complete blood count was a white count of 23, a hemoglobin of 9, hematocrit of 30.9, and platelets of 147.
okay. Did y'all do any labs? I guess I can just short circuit it by asking you, did you do any labs or order any labs for any indicators or any any indicators of malnutrition?
She had an albumin drawn that was 3.5 normal. That's a normalish range for an albumin.
Can you say it again?
Albumin, it's one of the main proteins in your blood that keeps the liquid inside of the blood vessels or draws it back in. It was 3.5.
Okay, and what should it be?
Around there. So 3.5 to 4.5.
Okay.
So it was adequate.
That's one of the things that they test. Pre-albumin and albumin are two of the indicators that they test for to determine if there's malnutrition, correct?
Yes,
And a child can be small without being malnourished, correct?
absolutely. And so she actually, unfortunately, in San Antonio, there's an obesity epidemic. And so we tend to think of kids that are,
Tell me about that.
yeah, I know. We think of skinny kids as not being well nourished. But she actually was 10th percentile on her growth chart for height and for weight. And that's where 10% of people live, or that at least 10% are at the 10th or below it. And so
Exactly. So when we say 10th percentile, that means out of
100 kids, actually out of 100 white kids in Denver, is what these are all based on.
Okay, that she's gonna be among the bottom 10% of that.
She would be at the
in
bottom
terms of
10% of it, but just like not everybody is 6'4", everybody fits on that spectrum somewhere.
weight. Okay, and that doesn't necessarily indicate malnutrition, correct?
Yes.
And also, I think another witness testified that, and you see a lot of child abuse and neglect. Another witness testified that malnutrition, that one of the indicators of malnutrition can be extra hair growth.
Mhm.
Had you heard that?
Lanugo.
Do you agree
Yes.
with that?
I agree.
Okay, and but that also doesn't necessarily indicate malnutrition, correct?
Not necessarily.
There are a lot of,
There's a lot of
Particularly
different,
Hispanic kids.
again, it's a whole, sorry. Yes.
sorry. Among that particular demographic, there tend to be kids who have what might be considered extra hair growth, correct?
Absolutely.
Okay. You also said that Olivia's brain had shifted to one side.
Mhm.
The entire brain had,
So the midline, so the line that runs in the middle had shifted over by about 8 millimeters.
okay. And you said that takes a lot of pressure. Is it the ICP that causes that shift?
The ICP one side to the other. So when they put in the pressure monitor, let's see, they put it in the so Peggy didn't mention it, but yeah, so they'll put the pressure monitor into the brain, and that will tell you what the pressure inside the skull is. It was 62 when they first put it in. To push the brain over from one side to the other, you just have to have more swelling on one side than the other
I see. Okay,
to shift.
got it. Pass the witness, Judge.
State.
Briefly, try to be quick. So just to be clear, when you're talking about the retinal hemorrhaging and the shear force, acceleration, deceleration, can that be caused by a strike to the head?
Yes.
Okay. Can a pneumothorax or a hole in the lung, can that be caused by being struck with something?
Yes.
A spontaneous pneumothorax, is that something that you see in 4-year-old girls?
Not in non-syndromic kids. No,
I couldn't hear you. I'm sorry.
non-syndromic kids. So there's a couple of like connective tissue diseases that like Marfan syndrome where you're really, really tall. Those kids can have them early on, but it's usually in the teenage years.
Okay. You mentioned CPR could cause a pneumothorax.
Yes, ma'am.
Is it the pressure? It's like the pushing down, or does it have to do with a rib breaking?
It's just it's the amount of pressure that you're putting on there.
Okay.
And so if you're trying to give them a breath while someone's pushing, that can cause it, or just the pressure itself if your airway's a little bit closed because you have drool or something that's causing you to collapse your airway.
And the pneumothorax had been resolved by the time you saw her. Is
Yes,
that correct?
the chest tube was in place.
Okay. Now, as to those previous entries, I think there's one from 2015, 3 from April of 2016. When a young child comes in, what is where is the source of information?
Children are typically bad historians, and so usually you ask them what's wrong, and then you turn to the parent and ask what happened.
So if Miss Briones had developed a plausible story to tell doctors that would explain an unusual injury, would they have any way to doubt if it was just a simple scrape?
No, you rely on the parent to tell you the truth, and you also, you take it in context of, yeah, that sounds plausible.
You mentioned you didn't think that that Miss Briones was on drugs, but did you find anything unusual about her behavior?
Her affect was a little bit off. So usually when you're telling people about the extent of injuries and that your kid is probably going to die, that there's, there's more of a reaction to it. This was more of a very stoic, like, oh no, kind of reaction. That it wasn't what I would do, but that's me. But I found it odd. I talked to, unfortunately, lots of people whose babies are going to pass away, and it was one of the more odd experiences that I went through, just because I've had I've had to do this too many times.
So last question, being 10% as far as weight, in a vacuum, it's acceptable. Would that be correct?
Yes.
The fact that she, well, let me change my question. Was she always in the 10% range of weight?
So I didn't go back and chart it, but she weighed more when she was 17 months younger. So yes, she would have been significantly, she would have crossed percentiles,
Okay.
which is another flag for malnutrition.
So that deviation from a healthy curve.
Yeah, you see them going well and then things kind of start falling off.
Thank you. No further questions.
Just a couple more, Doctor. Yeah, no, my point about the pneumothorax, I'm not saying it was spontaneous or that it was caused by the CPR or by the bagging. All I'm saying is it could be a lot of things, right?
Yes.
Okay. Including it could be from trauma related to an accident, correct?
Absolutely.
You said you have did you say that her reaction wasn't the reaction you would have had?
It wasn't a typical reaction. So
Did you say
like that I would have had? Yes.
that's what you testified to, right?
Yes.
I didn't mishear it. Okay, that's all I was checking. But you have seen, I'm sure. Well, how many times? Let's forget about child abuse. Forget about any of that. Just you work in the NICU, right?
The PICU, sorry.
PICU, sorry, pediatric ICU. So you see a lot of traumatic cases. You probably have to give a lot of parents a lot of bad news, right? How many would you say that you've had to give devastating news, either that your child is dying or your child's going to be, maimed for life? Or
Yeah. So it's going to be in the couple hundred probably. In the 10 years I've been doing this, I've talked to a lot of parents. At Texas Children's, in my first month of fellowship, they had shut the liver program down here, and we had 17 kids die in that first month, to the point that they sat us down like, it's not always this bad. But it's quite a bit. So I would say, over the last month, I've done it like 6-7 times.
okay, and in that that hundreds of times that you've had to give parents bad news, I am sure you have seen a broad spectrum of emotional reactions, correct?
Yes,
Including parents shutting down emotionally, correct?
I've seen parents shut down emotionally. I've had a chair thrown at my legs. It runs the gambit.
You've had a what?
I've had a chair thrown at my legs.
Oh,
So it runs everywhere.
yeah, okay. Ask the witness, Judge.
State.
No further questions.
All right. Is this witness excused or subject for recall?
He's excused from the state.
Judge, I know he's busy. I would like to keep him subject to standby, but if we can agree to do any further testimony by Zoom, I'd be happy to do it that way.
That's fine with me.
All right, the rule has been invoked. What that means is you can't discuss your testimony with anyone. Only persons you're allowed to speak to are attorneys for the state or the defense. But make yourself available if you are recalled. Both parties have agreed that if you are recalled and you can't appear in person, then you can appear by Zoom.
That's great.
All right,
Thank
thank
you, guys.
you. Does anyone need a break? Okay, all right. Yes, so you all remember you have to do that. All right, before I let you go, my rules. You're not allowed to deliberate. You're not allowed to discuss anything amongst yourselves. You're not allowed to do any investigation. Make sure your tags are visible if you're going to be walking around. Do not do any research. If you see something about this case anywhere, just ignore it and move on. Does everyone understand? All right, everyone, please rise for the jurors. And I'm sorry, we'll be back at 3:15.
For the record, can
And state, call your next witness.
State calls Michelle Davila.
All right, if you'll take a seat here, please. Can you raise your right hand? Do you solemnly swear or affirm the testimony you give will be the truth and nothing but the truth, so help you God?
Yes, I do.
All right, you can have a seat and just make sure you speak in the microphone so that everyone can hear. And if you'll state your name for the record.
My name is Michelle Davila.
Hi, Ms. Davila, if you can just, that mic in the back, yeah, the
This one?
other one. No, you just want to push it towards you a little bit.
My name is Michelle Davila.
Thank you. May I proceed, Your Honor?
Yes.
Ms. Davila, are you currently employed?
No.
Okay. Are you retired?
Yes.
Congratulations. Prior to being retired, what did you do?
I was a San Antonio police officer for 22 years.
And with the San Antonio Police Department, what was your, I guess, rank?
I was a patrol officer.
So if you could just briefly describe for this jury, what are the steps to become an officer with the San Antonio Police Department?
Well, as far as training you go through, I went through 32 weeks of the police training academy, and then that made me a patrol officer. And by the time I retired, I had become a field training officer in addition to that.
If you can briefly describe for the jury, what is a field training officer? Or I'm going to refer to it as an FTO.
When police officers graduate from the academy, they're assigned to three different officers to train with, and I was the beginning trainer of officers who were fresh out of the academy.
And when did you retire?
May 1st of 2021.
And when did you become an FTO? If you remember.
I believe it was in 2012.
So approximately 10 years plus or minus that you were an FTO.
Yes.
On or about September 5th of 2017, what was your role within the San Antonio Police Department?
I was out working the Prue Road daylight section, and I was training an officer.
And were you on patrol at that point?
Yes.
If you can generally describe for the jury, what parts of town does the Prue substation service?
The Prue substation goes all the way out to like 1604 and Calabria Road to Fredericksburg 410 area. My district was the medical center.
So is it fair to say during your time, at least during this period of time, you got called out to the hospitals pretty frequently?
Yes.
So again, drawing your attention to September 5th of 2017, were you dispatched to University Hospital?
Yes, I was.
And at that point, you said you were a field training officer.
Yes, I was.
Do you remember the name of the officer that you were assigned to?
Michael Fisher.
And do you remember approximately what time you were dispatched?
Somewhere around noon.
Did you write a report in this case?
I don't believe so.
And why was that?
The officer that I was training writes the report and I guide him through it.
So as part of that guidance, are you reviewing the report that they write
Yes.
and making sure that it comports with both of your recollections of what happened and who you talked to?
Yes.
Would having a copy of his report help you refresh your memory as to this case?
Yes, sir.
Your Honor, may I approach?
Yes.
All right, Ms. Dodd, I'm going to show you what's been marked as State's Exhibit number 28 for identification purposes.
Okay.
Do you recognize this document?
Yes, I do.
And have you been previously able to review it?
Yes, sir.
So, I'm sure you've heard this before. Just make sure you don't read directly out loud from it, but if you need to read it to refresh your memory, please do so. Let me know, okay?
Okay.
After reviewing your report and refreshing your memory, do you know approximately what time you were dispatched?
It's going to be around, let's see, 12:30 in the afternoon.
And where were you dispatched to?
University Hospital Trauma Room.
At that point, do you know why you were being dispatched?
Yes.
And for what reason were you being dispatched?
We were dispatched for an injured child that came into the police substation and taken to university as soon as possible because of the severity of the injuries. And there was no time to investigate at the substation. So we got sent to the hospital to do our initial investigation.
So when you get to the hospital, do you remember the first person you talked to?
I arrived probably before EMS. I believe we arrived, we sat in the car. EMS came in and Officer Salaya had transported the mother of the injured child and we met with her.
Do you remember her name?
The mother of the injured child is Jessica Briones.
And do you see Jessica Briones in the courtroom today?
Yes, sir, I do.
And can you point at her and identify her by a piece of clothing?
She's wearing a blue sweater.
And Your Honor, as to the record reflect that she's identified the defendant.
Object to asking the court to comment on the weight of the evidence.
All right, the record will reflect what it reflects.
When you initially met with Miss Briones, the defendant in this case, do you remember what her demeanor was like?
She was just mild mannered, not very emotional, just kind of very blank, stare on her face and just kind of, I don't know, for lack of a better term, lost.
And did you talk to her about what happened?
We did. We asked her, what happened to her child that led to her taking him to the police station.
Eventually, were you able to meet or see the child that was in question?
Yes,
And do you remember the child's name?
Olivia Briones.
And what did you observe about Olivia?
The very first thing I observed with it, she had a little bruise right at the bridge of her nose, which caused me to kind of look a little more. And I saw some bruising on her face, light bruising. I mean, this one was very distinct. And then, of course, the trauma staff is dealing with this child and you're not able to just get up and close at first. But I noticed one of the people there, whether they were a nurse or who they were, I'm not exactly sure, but they were picking up her hands and looking at her hands and her feet, which caused me to look at that when I was able to get closer. And I noticed more bruising underneath nail beds on her feet and her hands. And I also saw the nurse or one of the staff go like this with her arm. And after looking at it, you could see that it looked a little deformed.
So in your career as a patrol officer, and especially as it relates to your time when you were assigned to the medical center, have you seen or investigated cases that involve injuries to children?
On multiple occasions. Most of my career was spent in hospital districts, mainly at the medical center.
And in your memory, does Olivia's injuries, do they stand out?
Yes, sir.
How so?
I had seen most of the injuries Olivia had on other children, but I had never seen all of them at the same time on one child.
So after you observed the child, and I should go back. Your Honor, may I approach?
Yes.
I'm gonna show you was already been previously admitted as. Show your hand. I believe what states exhibit number 5. Does that look similar to how you saw Olivia on September 5th of 2017?
Yes.
So you talked to mom. Did you do anything after talking to mom, but before seeing Olivia?
Well, I initially consulted with the officers that brought her in, mainly Officer Salaya, and she just kind of told me that, she had walked into the substation carrying this child and said she wasn't breathing. And then that's when I, contacted Miss Briones and asked her, what was going on, what happened to her child, and she didn't know, or she said she didn't know.
Was she able to provide to you any explanation as to all of the injuries that you observed on Olivia?
No, she never did.
So after you talked to Miss Briones, what did you do next?
I went to observe Olivia as best that I could while they were working on her. And when there became a break, when they took Olivia to do a skeletal X-ray and MRI, I was able to talk to some of the people that were up and close and treating her. At that point, one of the trauma doctors had contacted Miss Briones and was also asking her what happened to Olivia. And she said she didn't know. And so I was listening to that at the same time I was trying to talk to the staff. And then one of the main things that stands out is the doctor said, I don't think these injuries are survivable.
So after you overhear this conversation between the doctor and Miss Briones, what did you do next?
We contacted the detectives and told them we needed them to come out to the hospital. And, I knew at this point, this was going to be an abused child case and that we would need to secure the apartment where she came from. And so I called for all of those people to do all of those things.
Eventually, was a search completed of Miss Briones' apartment?
Yes, I was not there for that search.
Do you know how SAPD was able to search the apartment?
While we were in the emergency room, I took out our consent to search form. It's a standard form, and asked Miss Briones if she would be willing to let us look through her and look at her apartment. And she willingly signed the form and said she had no problem with that.
And at that point, was Miss Briones under arrest?
No, sir.
And so you presented this consent to search form. Did you go over that form with her?
Yes.
Did she have any questions about it?
She didn't ask any, I don't recall.
I couldn't hear you.
She didn't ask any that I recall.
If she had asked questions, would you have answered those for her to the best of your ability?
Absolutely.
After going over that form, did she sign the form to grant consent to search the apartment?
Yes, she did.
And did you also, were you present when she signed that form?
Yes, I was. And I also signed the form.
Your Honor, may I approach?
Yes.
Let's call you officer, former officer Dobbin. I'm going to show you what's been marked as State's Exhibit number 29 for identification purposes. Do you recognize that document?
Yes, I do.
And what do you recognize it to be?
It is a consent to search form 2091C. It was the valid one for that time period.
Okay. And in fact, isn't your name and badge number indicated at the top of the consent to search form?
Yes,
And was this signed by Ms. Briones as well?
yes,
Giving access to search the location at 10503 Evening Road, apartment 535.
yes,
Beyond at this time, state would move to admit exhibit number 29 under tender to defense counsel for objections that any had previously tendered in discovery.
No objection, Judge.
All right, state's exhibit number 29 is admitted without objections.
So after you get consent to search the apartment, what did you do next in this case?
I waited for Detective Barnes to arrive at the hospital. I believe I turned over that consent to search form to her. I was instructed to take Ms. BRIONES down to headquarters if she was willing to come to give a statement, which myself and Officer Fisher transported her down to the main headquarters.
So as far as her transportation is concerned, was she under arrest at that point?
No,
Was she told that she did not have to go downtown?
I believe so. I asked her if she was willing to come down with me to talk to a detective, and she did.
Did you force her to go downtown with you?
No,
So she voluntarily went in your patrol vehicle downtown to give a statement.
yes.
Were you present while she was giving that statement?
In and out. There was a room that you can watch the statement go on. I was busy talking to people at the scene and other things, so I did watch some of her interview, but definitely not all of it.
Is it fair to say you were an active participant in that interview?
I did not interview her at headquarters.
After she was done with her interview, I should ask this. Did you stay at headquarters the entire time that she was completing her interview?
Yes,
So were you at headquarters when she finished her statement?
yes, I was.
Did you do anything after she completed her statement to police?
We asked her where she wanted to be transported back to. She said she wanted to go back to University Hospital, but she needed to stop by her apartment. We did take her over there briefly and then back to University Hospital.
So after you take her to University Hospital, were you complete with this case?
No. I contacted the pediatric staff at that point, checking on the status of Olivia. I was told that there was no brain activity and that they would probably take her off life support the next day if they didn't see any. And I advised the staff, I advised who she was. They weren't supposed to be letting anybody in there to see the baby except for law enforcement or detectives. So we just made sure that that was in effect to keep Olivia safe.
What time, at this point in time, do you remember what your hours were?
It was late. I do believe probably around 10-ish, 10 o'clock at night, I was getting off to go home.
Okay. Did you go home?
I did.
Okay. Did you stay home?
No,
Why not?
because for whatever reason, I could not sleep and get this case out of my mind. So I went back to the hospital because all I could picture was that child all by herself in that room. And so I went back there before my shift for a few hours, just to provide whatever little comfort I could to her.
And were you ever made aware of Olivia's passing?
Yes.
How so?
Following day, well, I mean, that same morning, I went to work, I went through roll call, and eventually a call came across the screen letting us know. But I knew that the time was going to be around 11 o'clock. If there was no brain activity, they were going to go ahead and pull the plug. So I had actually called up there and they said, yes, they've made that decision. They just haven't done it yet. So then I saw the call come across the screen.
So at 11 o'clock, where were you?
I went back up to the hospital.
Why is that?
I was just very sad that this child was by herself and she was so severely injured and no one was with her. And the peds nurses have a lot to do. I mean, they can't just sit there. And so I just couldn't leave it.
When you were at the hospital, was Miss BRIONES at the hospital when she passed?
I did not see her the next day.
You retired when again?
April of 2021.
Why did you decide to retire from SAPD?
After handling this case in the trauma room, I just remember saying a little prayer. I can't do this anymore. Lord, please find me something else to do because I can't see this, can't do this anymore. So I started working on my retirement plan. I actually transferred a few months later to a community service unit and just went as long as I could. And then I decided I was done.
So was this case and the injuries you saw part of your decision to retire?
Object to the relevance, Judge.
Sustained.
I'll pass the witness.
Defense.
So you asked Jessica what happened to Olivia, and she told you she didn't know what happened, correct?
Correct.
What was her demeanor like at this time?
She was very calm.
The whole time she was at UHS?
Yes. She was calm the whole time she was with us, the whole time I had contact with her.
Okay. All right. And you said when you called the detectives, you said, I knew at this point it was going to be an abused child case. So you'd already decided at that point that this was child abuse, correct?
I had decided at that point there were enough injuries that the likelihood of it being a child abuse case was real. We needed to do the whole investigation. We need to make sure we dotted our i's and crossed our t's.
Okay. But you said you knew it was going to be an abused child case.
Yes,
Okay, so that was what you were looking for evidence of, correct?
yes,
Okay. And Jessica was cooperative, correct?
yes, she was.
She signed the form, she answered all your questions, right?
Yes, she did.
And you're the one who told the staff at UHS that Jessica could not get in to see her child?
No, I was told that that was the case. I guess the detectives had, or CPS had put in that safety plan and the detectives had made me aware of that.
By whose authority?
The Child Protective Service,
Did they have a
Case-
judge's order?
I'm not sure.
Okay, and so you went to make sure, even though you didn't know if there was any legal authority for this, you went to make sure that Jessica was not going to be allowed to see her child while her child was in the hospital. Is that
I went
correct?
to make sure that they knew that we were told that we were supposed to be the only ones in there and to make sure they knew who she was.
Okay, and forgive me, I understand this was upsetting to you, but you knew this child for 5 minutes.
Yes,
Jessica, this was her daughter. And she was not allowed to see her own daughter because you and others had decided that this was child abuse before you had any evidence. She was not allowed to see her own daughter even when that child was taken off life support. Is that correct?
I don't know if she was able to see her when she was taken off life support. I just know she wasn't there.
But she wasn't there because she was told she wasn't allowed to be there, right?
I don't know at that point.
Well, you told the staff.
I told the staff that we were we were told that only SAPD should be in there, but I wanted to make sure they knew who she was in case she was in there. I just didn't want anything else to happen to Olivia.
Okay, so when you were upset that this child was all by herself in that room, did you think to go get Jessica and bring her rather than have a stranger sit with the child, to bring her so that you could supervise? You're going to be there anyway.
When I went back to the hospital, I did not see her. I went home initially and drove back when I couldn't sleep.
I understand that, but you didn't make any attempt to bring Jessica to see her own child.
No.
correct? Okay. Did you have a body worn camera,
Yes, I did.
and was it operational?
Yes,
And did you make a recording of your interactions with Jessica on September 5th?
yes, my body cam was running during this case.
I pass the witness, Judge.
State.
I just want to follow up on just one thing. The night that you talked to Jessica and the night that she was interviewed, after completing her interview, you took her to University Hospital. Is that correct?
Yes,
So as far as you are aware, was there anything preventing her from being at the hospital?
no, and we were told she was allowed to be at the hospital.
What was your understanding of who could be in the room with the child?
It would be law enforcement personnel or medical personnel, because at the time they didn't know who hurt Olivia, and the safety plan was implemented to keep her safe.
And so just so that I'm clear, was this like a unilateral decision that you made to prevent her from being in the room?
I did not make that decision. Child Protective Services made that decision.
I'll pass the witness.
And I understand, and I apologize if I wasn't clear. I wasn't saying that you made the decision to keep Jessica out of the room, but you did make sure, even though there was no legal authority for CPS to make that.
Judge, I'm going to object to the question in that it presupposes facts, not in evidence, and the defense counsel is attempting to testify about what orders were in place.
All right, that'll be sustained.
Judge, her testimony was that she did not know of any legal authority that CPS had to make
If you
that.
want to ask that question, you can.
Thank you. Did you know of any legal authority that CPS had to keep her out, to keep Jessica away from her own child?
Typically, when CPS is working on a safety plan, that's good enough until the judge signs off on it. It's to keep someone safe, a child safe, or an elderly person safe, all the way around until a judge's order can be granted.
Okay, but you say typically that's what happens, but do you know of any legal authority for that?
No,
And in this case, there was no judge's order, correct?
as far as I know, I don't think so.
Pass the witness.
No further questions for this witness.
All right, is this witness excused or subject for recall?
Subject to recall, please, Judge.
All right, the rule has been invoked. Miss, yeah, the rule has been invoked. What that means is you can't discuss your testimony with anyone except for attorneys for the state of defense. Just make sure you're available if someone wishes to recall you. All right, thank you. State, call your next witness.
State calls Brenda Oliva.
Raise your hand for me, please. Do you solemnly swear or affirm the testimony you give will be the truth and nothing but the truth, so help you God?
Yes.
All right, you can lower your hand. Make sure you speak up and speak into the microphone. Could you state your name for the record, please?
My name is Brenda Oliva.
State.
Thank you, Your Honor. Miss Oliva, how are you employed?
I'm a CSI for San Antonio Police Department.
And what does CSI stand for?
Crime scene investigator.
So is with San Antonio Police Department, are there different types of roles of people that collect evidence?
Well, for the crime scene unit, we pretty much all do the same thing.
Okay, fair to say there's like uniformed and UEDIs as well as CSIs, right?
Oh, yes.
What's the difference between a detective versus you and people that collect evidence with SAPD?
So we have the UEDIs are sworn officers, and we're civilian.
Excuse me. Judge, could you instruct me to pull the microphone?
All right, if you'll pull the microphone towards you and speak, no, it's the one with the cover. And if
Thank
you'll
you.
speak into that, please. And have no fear to speak loudly.
Okay.
So Ms. Oliva, how long have you been with a crime scene investigator with San Antonio Police Department?
13 years.
And what training and or just probably what training do you get in order to become a CSI?
Well, I have a bachelor's degree in criminal justice and political science. And once I get hired, or once you get hired on with SAPD, they we have classroom training, 350 hours of classroom training, and then we ride with someone on patrol for the remaining of the training, from the remainder of the training.
Okay, so you get on to the job training as well as some training in a classroom with San Antonio Police Department.
Yes.
So, on September 5th and September 7th of 2017, were you employed as a CSI with the San Antonio Police Department?
I was.
And were you involved in the investigation of an entry to a child case involving a victim by the name of Olivia BRIONES?
Yes, I was.
Do you recall when you were first dispatched on this case?
It was September 5th, 2017. It was right on shift, so maybe closer to 3 o'clock.
Okay. Would having a copy of your reports help you refresh your memory?
Yes, please.
Come on, 30?
Yeah.
Ms. BRIONES, these are just her. Reference reports. Ms. BRIONES, I'm going to show you what's been marked as state's exhibits numbers 30 and 31 for identification purposes. Do you recognize those documents?
Yes, they're my reports.
Okay, so is it fair to say that you completed 2 different reports in this case?
Yes.
So if you need to refresh your memory from the report, please do. Just don't read directly from it out loud, okay? So if you look at your report, do you remember approximately or what time you were dispatched in this case?
254.
And where were you dispatched to?
10503 Hebner Road.
At that point, were you aware of why you were being dispatched
Yes.
and for what reason?
I was told that a child had been injured.
Okay, and so do you know what your role was going to be when you got to the scene?
Barely, yes.
And what was your understanding of what you were going to do there?
We were going to process the residents for any items of evidence relating to that injury.
Typically, when you go to a scene, and this is you're being requested to process a scene, what does that mean? What are you going to do?
Collect evidence.
Okay. Are you going to take photographs?
Yes.
Are you going to potentially make videos?
Yes.
Potentially do sketches?
Yes.
And again, collect any evidence that you might see.
Yes.
So is that what you did in this case?
I did.
And do you recall where you were dispatched to?
The address on Hebner.
Okay. Do you specifically remember the address?
on my report, 10503 Huebner.
Okay. Before you start processing a scene, are you made aware of, like, if there's a search warrant, if there's consent prior to you doing that?
Yes.
In this case, are you aware of what grounds you had to search?
My coworker had been dispatched before me, so he got there previously. When I got there, he told me that we had gotten a search warrant to process.
Okay. And who was the first person, you said your partner that arrived?
My coworker, CSI Pettis,
Okay. What's his first name?
Roland.
There's a lot of Pettis in San Antonio, right? So as far as it relates to September 5th of 2017, and you're processing the scene at 10503 Huebner Road, what particular things did you do at that scene?
When I got there, I talked to CSI Bettis. He had informed me of the processing of the residents. But at that time, I was relocated to University Hospital.
Okay. So eventually, did you process the scene or help process the scene at 10503 Huebner Road?
Yes, I came back to help him process.
Okay. And in particular, in this case, on that day, what did you do at 10503 Huebner Road?
I did a video of the crime scene and I drew a sketch of the scene.
Okay. And I want to talk generally about the collection of evidence. At the scene, if you collect, meaning you've taken to possession a piece of evidence, what do you do with it? Just generally speaking.
I will be collected, preserve it in our custody and take it back and process it.
Okay. Do you package those items?
Yes,
Do you uniquely mark the packaging?
yes.
And those unique marks on the packaging, what are they?
There are initials and our badge number.
Do you also mark it with the San Antonio Police Department case number?
Yes.
Once you collect that evidence, where do you take it to?
It goes to our property room at 401 South Frio.
And for those who might not know, what is the property room?
It's basically where we just store all our property, all the evidence items.
Is that a secure facility?
Yes,
So in order to gain entrance to the facility, do you have to have credentials?
yes.
And any particular credentials that you have to have?
Well, our ID, a picture ID.
So is it a secure facility?
Yes.
And in order to put something in the property, what's the process once you get there?
What do you mean?
So do you just walk in there and then put it on a shelf and say, thanks, I'm going? Or is there a process to get it into the property room?
No, it's usually after hours, so there's no one there. We gain entry with our ID. There's lockers that we secure that evidence inside.
Okay. And do you know what happens with it once you put it into a locker?
It'll stay there until something is done with it, meaning like follow-up will request further processing on it.
Okay. And when it goes into a locker, is there some type of like log that's kept to make sure that basically the property room knows what property is where?
No, we just secure it in a locker.
Okay. And in order to get out property from the property room, what do you have to do?
So that process is a little different. We have a main property room and we have one that we use after hours. We have to go to the main property room and sign out property.
Okay. So how does property get from the locker in the after hours to the main property room?
The staff at the property room, they come and pick it up.
And then they log it into the main property room.
Yes,
So to get it out, you have to contact them to get it out.
yes,
And did you do that in this case?
I did.
I want to go back to what you did on September 5th of 2017. you said you completed a video in that case.
I did.
What was the purpose of making a video?
It's just another form of, so we have photos and then we just have another form of the scene.
Okay. And so in this case, did you video the scene?
I did.
Your Honor, may I approach?
Yes.
I think 31.
Brennan, what am I- 32. Ms. Olivia, I'm going to show you what's in Marcus State Exhibit number 32 for identification purposes. Do you recognize that?
Yes,
And what do you recognize it to be?
a video.
And is this the video that you took on September 5th of 2017 that you just described?
Yes,
And have you watched this video?
I did.
And the particular, how in this case do you know that you watched what's on that disc?
Because I initialed it with my initials and badge number.
Okay, and did you do that today?
I did.
And this video, is it a true and accurate representation of the scene at 10503 Huebner Road on September 5th of 2017?
Yes, it is.
And the device that you made it with, what kind of device was it?
A video camera.
Okay, do you know how to work that camera?
Yes.
That sounds like a stupid question, but I
Okay.
and have you used that video camera before?
Yes.
Okay. After reviewing this, does it appear that this video has been altered or changed in any way?
No.
Your Honor, at this time, the state would move to State's Exhibit number 32, pending objections from defense attorney.
May I take this witness on board diary briefly, Judge?
Yes.
Officer, states 32, does it have audio portion?
It does not.
There's no audio.
No.
Okay, no objection, Judge.
All right, State's Exhibit number 32 is admitted without objection.
And Your Honor, may I publish?
Yes.
And just for the purpose of the record, I'm going to skip to 20 seconds because there's nothing up until 20 seconds.
No objection.
Say that's the end of your video.
Yes.
So just want to ask a couple questions. I'm not going to go through the video, but it appears that in the video, there are certain points where there's either yellow, like tent looking things or pieces of paper with numbers on them. Did you see that in the video?
Yes.
What are those?
Those are evidence markers.
And why are there evidence markers at those particular pieces or items?
Because those are the items that we're going to collect as evidence.
Okay. And so when you see on that video, like a tag with a 1, a 2, 3, 4, those items were collected.
Yes.
As far as the video is concerned, does the video depict every single room, closet, area, space within that apartment?
Yes.
So what's depicted on that video is the entirety of the apartment.
Yes.
As far as what you did at 10503 Hebner Road on September 5th of 2017, did you do anything else as it relates to that scene and on that day?
So the items that were marked as evidence, I drew a sketch of them.
Okay. And what is the purpose of that?
Just to show just to show where they're located.
And did you complete a crime scene or crime scene sketches in this case?
Yes.
And just generally describe for the jury, what is the process of creating a crime scene sketch?
So just depending on the room where the items of evidence are, we'll pick 2 points that create a 90-degree angle and measure the evidence off those 2 points.
Okay. And so did you do that in this case?
I did.
You got my approach?
Yes.
I'm going to show you what's been marked as state's exhibit number 33 for identification purposes. Do you recognize that document or that document?
Yes.
And what do you recognize it to be?
They're my sketches.
And did you complete those on September 5th of 2017?
I did.
And do those appear to be altered or changed in any way?
No, they're mine.
And do they truly and accurately represent the items of evidence marked in the description of the location?
Yes.
And it appears it says not to scale on the bottom. What does that mean?
It's just we take measurements at the scene, and it's, I mean, obviously it's not an image of what we actually see. It's just on paper what we.
Okay, it's fair to say that, let's say a wall is 2 feet and the other wall is 4 feet. They're not going to be exactly proportional on the sketch, right?
Right.
But the measurements are going to be indicated are accurate.
Yes.
Your Honor, at this time, state moves to admit state's exhibit number 33 and tender to defense counsel for any.
No objection, Judge.
All right, state's exhibit number 33 is admitted without objection.
I'm gonna move forward to September 7th of 2017. Were you asked to complete any additional work on this case?
Yes.
And what were you tasked with doing?
So at the scene, CSI Bettis had collected a metal bar. So the follow-up detective had asked for me to print it and swab it with a biological swab.
Okay. And did you do that in this case?
I did
And where did you do that
at the main property room on Academic Road.
So is it fair to say that this item of evidence that you were going to print or try to print and try to swab that was already in the property room prior to you going there.
Yes.
And based on your understanding, who entered that piece of property into the property room originally?
CSI Bettis.
I didn't hear.
CSI Bettis.
Did you also photograph that item of evidence?
I did.
You know what I mean?
Yes.
Ms. Olivia, I'm going to show you what's been marked as state's exhibit numbers 34, 35, and 36. Do you recognize those?
Yes, these are my pictures.
And what do they depict?
The metal bar and the size of the metal bar.
Okay. And do they truly and accurately represent the metal bar as it was in the property room on September 7th of 2017?
Yes, it does.
And especially as it relates to state's exhibits numbers 35 and 36. Do those truly and accurately represent the size of the metal bar that was taken into property?
Yes, it does.
And again, what's depicted in state's exhibits numbers 34, 35, and 36? That item was collected on September 5th of 2017 at 10503 Evener Road.
Yes.
And at this time, state would move to admit state's exhibits numbers 34, 35, and 36.
Judge, I mean, I've checked that they're a little cumulative, but I don't,
All right, if I
Yeah,
could see states exhibits 34, 35, and 36,
I'm sorry.
if I can see those. All right, state.
Your Honor.
States exhibits 35 and 36 are admitted. States exhibit number 34, the objection is sustained.
And, Your Honor, may I publish it here?
Yes.
Just very briefly. I'm going to put both states exhibits, what's been admitted as states exhibit number 35 and 36 there on the screen. Is this that metal bar that you were describing?
Yes.
And it appears to be, there's a ruler next to it, correct?
Yes.
And approximately how long was that that metal bar?
Can I look at my report?
Yes.
It was 60 centimeters.
You previously just testified to the fact that you were there to do two things. It was to swab it and to print it, correct?
Yes.
Were you able to lift any prints from what's depicted in State's Exhibit number 35 and 36?
Unfortunately, no.
So you attempted to, but were unable to.
Right.
In your experience as a CSI, approximately how many times have you attempted to print a piece of evidence?
Countless,
Hundreds, thousands?
well, numerous. I mean, I don't have a number.
I'm sorry.
I don't have a number. I mean, many times.
Okay. Would you say that it's frequent or infrequent that you are able to actually lift prints?
Pretty frequent.
Okay. Is it infrequent for you to be able to get prints off of something?
I mean, it happens sometimes, just depending on the surface.
Okay. Is it fair to say there's a lot of different situations or scenarios that there might be a reason that there wouldn't be prints on something?
Yes.
So while you were there, did you also complete a swab on states, what's it depicted in States Exhibit number 35 and 36?
I did.
In coming here to court today, did we ask you to bring certain pieces of evidence from the property room with you?
Yes, you did.
And all of those pieces of evidence, did you collect all of those?
No.
Were some of those evidence that you brought here today, were those collected by CSI Fedos?
Yes, they were.
Can I approach?
Yes.
So just that we have these marked for identification purposes. Thank you. So I'm going to show you what's been marked as States Exhibits in verse 37 through 42. Which are all these items. Did you bring all of these items with you here to court today?
Yes, I did.
And where did you pick up these items?
At 555 Academic Court, which is our main property room.
So you went to the property room today, you got these items out from the property room and you brought them here to court today.
I did.
So I want to talk about in particular States Exhibits numbers 37. Let's just start with 37 first. States Exhibit number 37. Did you collect what is inside what's marked States Exhibit number 37?
Yes, I did.
And how do you know you collected it?
Well, the ME did some work on this, but these are my barcodes that I made.
Okay, so you place those barcodes on that particular piece of evidence.
I did.
And what is contained inside State's Exhibit number 37?
They're 2 biological swabs.
And are these the swabs that you just described that you took on from what's depicted in State's Exhibits numbers 35 and 36?
Yes,
And you completed those swabs on September 7th of 2017 at the property room.
I did.
I'm going to show you what is marked as State's Exhibit number 38. Did you collect this particular piece of evidence that's contained within State's Exhibit number 38?
No.
And are you able to tell who collected that?
CSI Bettis.
And then I'm just going to collectively talk about State's Exhibits numbers 39, 40, 41, and 42. You could look at those for me. Are you able to tell who collected those particular pieces of evidence?
Yes, CSI Bettis.
So as it relates to State's Exhibits numbers 39 through 42, it was in fact CSI Bettis who collected them initially at the scene.
Yes,
However, you brought these pieces of items of evidence with you here to court today.
I did.
Um, get rid of this. Brendan, should I give you yours or is that?
No.
Miss Olivia, I want to talk. Just. State's Exhibit number 37, which I believe you just testified that you collected these, right?
Yes.
If you could just using this however you can, open up the envelope. Yeah, you can take it. 37. I'm gonna mark, it appears that there's 2 folders in there, correct?
Yes.
I'm gonna mark one. Basic Exhibit 37A and the other one, Basic Exhibit 37C. You could open State's Exhibits and there's 37A and 37B. You could open those up.
Oh, sorry.
You can look in State's Exhibits numbers 37A and then 37B. Do those appear to be the swabs that you took on September 7th of 2017?
Yes.
Okay, and how do you know that?
My signature and all the identifying factors are on here.
Okay. So is it substantially in a similar condition as when you you took it on September 7th of 2017?
No, it's been reopened
Okay. And how do you know it's been reopened?
because of the tape and the initials.
Okay. And as it relates to swabs, are those frequently opened?
Yes, they'll be tested at the Bear County lab.
Okay. Other than that, does it appear that the swabs are in similar state?
Yes.
And Your Honor, at the time, the state would move to admit State's Exhibit 37A and 37B.
No objection, Judge.
All right, states exhibits 37A and 37B are admitted without objection.
Ms. Oliva, other than completing the swabs and completing the fingerprinting on what's depicted in State's Exhibit number 35 and 36, did you do anything else on September 7th of 2017 as it relates to this case?
I did not.
Your Honor, at this time, I'll pass the witness.
I
Defense?
concur for a second, Judge.
Yes.
Oh, okay. So I don't have very many questions for you at all, Ms. Oliva, just how long did you say you've been doing CSI work?
About 13 years.
13.
Yes.
And Detective Juarez told the jury that there was a metal bar found in the living room. Did you see anything like that on the video or when you were there?
I can't recall that.
Okay. This states exhibit 35, 36, that bar was found in the back closet of the master bedroom, is that right?
Yes.
Okay. And can I see your reports, please, for a sec? You still have those up there? When you put these, put anything into the evidence room, do you get a receipt for it?
When we place evidence in, like at the end of when the processing? I don't know what you mean.
I can simplify it. Do you know what that is?
Yes, it's a
Okay.
property sheet.
A property sheet,
Yes.
okay, and is that something that they give you from the property room when you check it in, or how's that work?
That's automatic. When we make labels, it's labeled. So it's just something that's automatically made up when we when we make up our barcodes. It's basically just a property sheet of those barcodes that we made.
So the barcodes go on the physical evidence itself,
Yes,
and then you also have like a sheet that,
the sheet is just a printout of what we made as far as the labels are concerned.
okay, so you're the one who makes that property sheet?
No, it's just generated through when the barcodes are made. It's generated there. It's just a printout of what I've already made. But it's
Okay,
not
but
something additionally that I make.
But there's factual assertions on that sheet. right?
Yes,
Saying, you just describing what each object is or what each
Right.
barcode relates to, right?
yes.
So who puts that information?
Well, when I make the barcodes, it's automatic. So that's just information I inputted. So a barcode is assigned to each item of evidence that I submit.
Okay. when you say when you make the barcodes,
Yes.
what do you mean? Is there a program that you're using? that-
It's through the computer. We just make a barcode of the item that we're submitting into evidence, which contains like case number, date, item number that it is.
But is it, okay, you're saying we just make a barcode? How- Do you sit there and write it out a barcode by hand? Like,
But we have a system which is called file on queue. So file on queue,
file on queue?
yes.
Okay,
So that's how we make the barcodes to that system.
and that's where you would input this information that is then printed out on the property report,
Yeah,
correct?
yes.
Okay, that's what I was trying to, so, and the reason I'm asking that, so any of these statements on that, what's titled here as a property report, those are your statements, and that's your description of what you think. Something that'll remind you what that is, right?
Or a description of whatever I put in there.
Yeah, okay. And I'm just gonna show you my screen again, if that's all right. Because there appear to be a couple of, and you mentioned CSI Perez
Yes,
was also working on this case. And there appear to be two different property sheets or two different parts of one sheet. Part of them are yours, part of them are Perez's. Is that right?
yes,
In the top part, it's pretty clearly separated, right? Where
Yes.
yours are. Okay, and Judge, I didn't anticipate this witness testifying today, so I had not printed this document out, but to save time and rather than have to recall this witness, if we could, print this out. Well, maybe I'll talk to the state about it.
Okay, thank you. Excuse me, state, I know that that's been tendered to council, but he didn't have it print out. Do you have a copy that's been printed out?
I don't right now, Judge, but I talked with Michelle and we have no problem printing it out and stipulating to it.
Okay.
Yeah.
Judge, I'm trying to print it out right now.
So that
If
you,
not, Judge, we can put it into evidence later. They'll stipulate.
Okay.
Quickly, I just didn't want to call the witness back. And then, so, and I know you're not looking at it right now, but would you have any reason to disagree with me that you put into that property report regarding what's been entered in evidence as state. Was it 30? Is that your swab?
that's not mine. E6 and
I'm sorry.
E6A and E6B.
Right, E6A and E6B, but that's. Oh, they're over there. Okay, thank you. These swabs, right? Yes. So what's been entered in evidence is 37, it looks like. That's your E6A, E6B,
Yes,
and that's what's the first two items on your property sheet, and the description of them. Again, I know you don't have it in front of you. You're welcome to look at it if you like to refresh your memory. But would you agree with me that the description that you put in was E6A swab of apparent DNA from exterior of bracket?
I did put that.
And then E6B swab of apparent DNA from interior of bracket.
Yes,
And by bracket, are you talking about the bracket that's depicted in states 35 and 36?
yes.
Okay, and when you say apparent DNA, was there some material on there that appeared to be DNA-ish?
Not visible.
Okay, all right, and then I think that's. Oh, and you arrived at 3 o'clock-ish on the 5th, correct?
Yes,
Did you take Any other, did you take any items from the place yourself?
From the Hebner residence,
From the resident?
evidence, no, not physical evidence. Just,
Just the picture.
yes.
Okay. Tesla.
Just one, briefly, when defense counsel asks you about apparent DNA, are you ever able to look at a piece of evidence and say that there's DNA on it?
No.
So what do you mean by apparent DNA when you put that on there?
I mean, we're swabbing, hoping that there's something related to DNA on there. I just use apparent because I don't know that there is something on there or not.
I'll pass the witness.
Nothing further, Judge.
All right, is this witness excused or subject for recall?
From the state's perspective, she can be excused.
We will excuse you.
All right, and could both parties approach, please? Ladies and gentlemen, we get close to 4:30 each time. I'm going to excuse you all for today. We are going to start tomorrow at 9 a.m. We're going to work our way through lunch, but I'm going to give you all an early break because we're only going to be able to do half a day tomorrow because I still have a docket to take care of. So we're going to start at 9, work our way through lunch. Of course, I'm not going to keep you here where you're thinking about lunch, but we're probably going to end up recessing tomorrow no later than 1:30. So we'll go from 9 to 1:30. And of course, we'll have breaks in between. Just let me know when you need a break. Remember my rules. Wear your badges. Don't do any investigation on your own. All the evidence that you need for this case is inside this courtroom. You're not allowed to talk to anyone about this case amongst yourselves. You're not allowed to deliberate. I will let you know when it's time for you to deliberate. Does everyone understand?
Yes.
All right, so I'll see you all here. Yes.
I'm sorry, before we break, the state was kind enough to print out the property report. If I could just get it marked and get the,
Yes.
thank you.
That'll be one for you.
Just one, right?
Yeah, number one.
All right, so defense, are you offering defense exhibit number 1 into evidence?
Yes, Judge, just showing it to the evidence tech and asking, and I would ask, is that your property report in this case?
The first half is,
The first step is. okay.
yes.
We have no objections. Judge.
Offer
All right.
defendants one, Judge.
Thank you. Defense exhibit number 1 is admitted into evidence. So no investigation, no talking about this case amongst yourselves, no deliberating. Everything you need to know about this case will be from inside this courtroom. Does everyone understand?
Yes.
All right, thank you. Pretty soon you guys are going to know that by heart. Everyone, please rise for the jurors.